It's Saturday morning at 10 a.m., so you know what that means. It's time for What's Up, Ocala? With tens of thousands of viewers every month on our YouTube channel and millions so far on TikTok, we are joined by our host, local owner, and broker of Great Expectations Realty, Andrea Praber.
Good morning. Welcome to What's Up, Ocala. I'm your host, Andrea Praber, and today I have my good friend Tirsa in here. Tirsa, tell everyone who you are, where you work, and where they can get in touch with you.
Well, my name is Tirsa Rodriguez, and I work for Mid-Florida Agencies, Florida Blue. We're at 628 Southeast at 17th Street, Ocala, and that is right across the street from Churchill, Publix, Longhorn's Ale House, if you're familiar with those restaurants in the area. Yes, I do visit Longhorns a lot. But anyways, my phone number is 352-566-1892. And I've been in Ocala for 20 years.
Yeah, that's
20
awesome.
years. So
okay, so you basically explain where you work. But the reason I had you come in is this is my rep. Okay, this is my person. So if I have to, each year we sit down and we go over, each year we sit down and we go over what is new in the health insurance options.
Yep.
And what is going to work best for my family this year. What the different, plans are and stuff like that, which I truly appreciate. I think you should do that each and every year. So when people are coming here and they're asking me, what are the options for health insurance? I'm like, oh, just call Tirsa. Just call Tirsa.
Thank you so much for that.
I don't know. I don't do that stuff. I got a person for that.
Thank you.
But I wanted to invite you in to maybe have a chat with some of those that are moving here, because obviously Florida Blue is not outside of Florida. So if it's somebody moving to the area or somebody new here, or maybe somebody that's never gotten insurance here, y'all, please get insurance. You're the one to talk to about that. What can you tell them? What advice?
So Florida Blue is technically Blue Cross Blue Shield of Florida. So we're doing business as Florida Blue. We sell health insurance, dental insurance, and some ancillary products. With that being said, because we are Blue Cross Blue Shield of Florida, we are an association. An association is per each state. So that's why you hear Blue Cross Blue Shield of Texas, Blue Cross Blue Shield of North Carolina, et cetera, et cetera, et cetera. Well, your plan, if it's a PPO, it will transfer to a certain point.
Okay.
But if you want like the full extent of having Florida health insurance, then Florida Blue is it. We've been here for over 75 years, and there are some instances where other companies have left, and we're the only ones that have been here. And we can talk about that a little bit later.
Yeah. So, Florida Blue, like I said, we've been chit-chatting and doing this year after year for years. My husband, the detail-oriented individual that he is, has grilled you into oblivion. And y'all have no idea what I'm last night. he really loves his details. I normally am just like, just go. I can't. But you've always had a lot of patience for all of those questions, and you've always answered them very knowledgeably. And I have to admit, when I first tried to do Marketplace, on my own, just went in there, because of course you can. That's a federal program, basically. But when I went in there and tried to even put in my own information, after about 3 hours, I was in tears. It was so convoluted and so confusing to me. And some people, maybe it's gotten better since then, but I doubt it. It was so awful. So I got a person. Have I ever paid you $1?
You have not.
I have not. So I don't know why.
My services are completely complimentary. So talk about the Marketplace.
Yes.
Oh my God. Okay. So
call the
Marketplace is totally different from group insurance. So if you guys are coming from group insurance, whatever, I always tell you, forget what you know. Okay. Some things will translate from one group insurance over to Marketplace because they are the same terms. But now you're talking about individual insurance. And the Marketplace, or healthcare.gov, is actually a product of the Affordable Care Act, which is a law that was passed back in 2010, if I'm not mistaken. The Affordable Care Act, it basically, the big I don't even know how many thousands of pages it is, but this is what it boils down to. It boils down to that based on your age, the number of people in your household based on your tax return, based on your income on your tax return, and what zip code you live in, you will get an advanced premium tax credit. That advanced premium tax credit is applied to your insurance premium to lower the amount, so that way you are only responsible for the other part of that premium.
Right.
Okay. Some people qualify for thousands of dollars. Some people qualify for $1.
Yep.
So
I do not qualify for $1, but it still does like a sliding scale.
Yes.
So I know I've sent people over to you, and they paid like $12 a month.
And it's really based
reasonable.
on, so it's really based on their income. For Florida Blue, I just, because I am with Florida Blue, we are considered captive agents, which means that we can only sell Florida Blue products or talk about Florida Blue products. Are there other plans on the marketplace? Absolutely. Mm-hmm. Unfortunately, if you call me, I cannot answer any questions about those, but I can tell you what Florida Blue has to offer. With that being said, like you experienced, there was thousands of plans on the marketplace. And it's like, what does this mean? And what does that mean? What is a deductible and a copay and a co-insurance? And what is my responsibility? Well, that's what I get trained for every single year, along with the law changes.
And just to clarify, there are, I would say, hundreds of plans even within Florida Blue alone. It's not like, okay, here's what you can get for your, no, it's literally, we sat down just last month before last. Yeah. We sat down and I was like, I hate doing copays because, some places you only have like a $5 copay. And then I end up getting a bill in the mail and they're like, you must pay this within 30 days or we're going to report it. I'm like, it's $5. I got to send you it. And some of them are kind of old school and don't take anything but a check. I haven't written a check in.
Oh my God. You and me both.
So I'm like, this is getting complicated. I don't want to do complicated. So I would really like to just be able to not have a copay or have it, taken as part of it. So we went through all of the options and I don't want to pay as much as what it was requiring to not have a copay. So we actually decided together that was maybe not what I actually wanted. But,
right.
But we had that conversation.
Yes.
And that's what I really appreciated is that we actually got to sit down and discuss what my options were, not just for me, but for our family too. Correct. I mean, it's for my whole family. So,
and what were some of the questions I asked you?
I don't remember. I just remember they were really good. What are the questions you asked?
So some of the questions I asked is, there is no pre-existing. By the way, the law says we cannot even ask about pre-existing. But I may ask you something along the lines, are you frequently seeing a doctor for a certain type of either illness or disease or, just a condition in general? Mm-hmm. Some of them are like diabetes. Some of them are like today I had a young lady had fibromyalgia. And those are things you're going to go to the doctor frequently for, which we have to keep those costs in mind. Mm-hmm. Your prescriptions is another thing that we have to keep the cost in mind. I asked you how many prescriptions are you and your family on, right? So because all that, at the end of the day, I want you to have a good plan that's not going to bankrupt you.
Yes.
That's the main thing.
I
want you to have a plan that's not going to bankrupt you, but at the same time, you're able to go see the doctor. Go get checked. Yeah. I will tell you, all the Florida Blue plans, your preventative, your wellness exams are at no cost to you.
Mm-hmm. It really is.
And that's a start to know where you need to be.
It really is. I have had Florida Blue for years, and I've been extremely happy with it. Now, my husband, I don't know if you guys know this, but Medicare is not voluntary. It's mandatory.
It is.
It was shocking for us to find out. So he got ripped off of that and put over to Medicare.
Yep.
No, I think he honestly was pouting for about 1.5 years. I am not even joking.
Listen, Medicare, even myself. So let me tell you my initial initiation into health insurance. Because a lot of it does revolve around Medicare, because we do, under 65, over 65, special situations, disabilities, and things of that nature. And when they said, when you turn 65, you get Medicare. That's standard. That's the way it is. You get a Part A, but the Part A is what you've been paying into all your life through your paychecks. That part doesn't cost you anything. Then you turn 65, you have to sign up for Part B. Part B is your doctors, your specialists, your lab work. There is a monthly premium with that comes out of either your Social Security, if you have Social Security, or out of your actual paycheck. So Medicare Part A and Part B only cover 80% of your healthcare costs. And that's where we kind of help you explain that. I mean, Andrew knows I take about an hour.
Yeah.
Whether you are non-Medicare or Medicare, to explain everything, and talk about your options. But yeah, Medicare A and B only cover 80%, and you have to decide what you're going to do with that other 20%. And that's where I can also help you make that decision.
Yeah. And there's C now, right? There's C as well.
Sorry
to go down this rabbit hole, but our listeners want to know.
Yeah. So, but when you go from one state to the other, depending on what you have, you're going to have to change that Medicare as well.
Oh,
yeah. You're going to have to change that Medicare. And whether you're non-Medicare or you are Medicare, you have 60 days to make those changes from the time you change your address. And depending on which address it is, that's the one that we need to start identifying where your 60 days starts. Mm. But Part C is Medicare Advantage plans.
Okay.
Medicare Advantage plans basically take an A and the B and the Part D, which is also required by Medicare, and puts it all into one package.
They're going down the whole alphabet at this point. Okay.
Yep. So here's a little bit of history about Medicare. So Medicare was done back with FDR.
Oh, really?
FDR is the one that signed it into law.
I liked him.
They had agreed back then that automatically the Part A, as long as you paid out your paycheck, it's not going to cost you anything when you retire. But when you got the Part B, no matter when it was going to be 56 cents back then.
Okay.
So you've always paid for the Part B.
Very reasonable at that point.
Yeah. Well, back then, the Great Depression.
Okay, maybe not.
Yeah. So it's always been A and B. Okay. Then somewhere in time around 2006-ish or so was where the prescription drug plans started to become a problem, because as we know, the pharmaceuticals.
Well, they got expensive.
I'm glad you said it.
I can say a little bit more than you can.
Yeah, you're right.
They did. They got expensive.
So they got expensive. So, Congress said, okay, well, we got to help our seniors because they can't afford their medications. And a lot of them are not seeking the right care because of that medication.
Right.
So that's where the prescription drug plans came into play. Mm-hmm. And those prescription drug plans all have a monthly premium, or some don't have monthly premiums, but then you still have to pay a cost share for that prescription. Just like you and I, we go and they say, okay, it's $12 for amoxicillin.
Whatever. Yeah.
Yeah. Okay. So it's the same thing for our seniors. They still have to pay a portion, but they also have to get this prescription drug plan because it was never included with Medicare. So as it was back then, you had Medicare A and B, 80% of your costs, no prescription coverage. Then they introduced the prescription coverage and said, okay, now you're going to have a monthly premium. Back then there was a monthly premium. Now a lot of plans, can fluctuate. So, but you still were responsible for 20%. And that's where the Part C came into play, or the Medicare Advantage plans. Gotcha. The Medicare Advantage plan said, okay, and the other thing too is that, the way I see it is it was introduced for those folks that are like you and me, healthy, really in their 65, 75, 80s, and they're healthy. And they don't want to pay a monthly premium for the other 20%, because when you have A and B, again, remember we talked about the 20% being your responsibility. Mm-hmm. Then you have to buy another supplement, and that's exactly what it's called, a supplement plan or a Medigap plan, and that carries its own monthly premium.
Yes, we've come into all of this. Mm-hmm. It was a learning curve. So yeah. Well, you mentioned that you have 60 days if you have this insurance, to come, if you're coming and moving into Florida, and you have 60 days to change that. Mm-hmm. But what about those that they're already here and they want to get insurance? I know there's a cutoff date, which I think we've already passed.
Yes, we have.
Okay.
So for Medicare, there is a October 15th through December 7th, what's considered an annual enrollment period.
Okay.
Okay. And then we are currently in what's considered the open enrollment period, and that dictates a little bit differently than the annual enrollment period.
Okay.
And that the open enrollment period is from January 1st through March 31st. But again, that's just Medicare.
Okay, that's Medicare. Okay, got
it. For
it.
non-Medicare, that enrollment period starts on November 1st and goes through January 15th. Now, 2024, January 15th was technically a holiday, federal holiday, so they extended it to January 16th. So kind of keep an eye out for those dates as well.
Okay.
But the open enrollment period is November 1st through January 16th. So if you've missed your window, you have to wait to get your insurance.
So what if it's somebody moving down here and they already have insurance? That doesn't even apply to them because they have that 60 days?
There's certain scenarios where that would apply.
I know there's loopholes. I'm going to ask about the loopholes. I love the loopholes. All right.
So if you're with group insurance, that probably goes with you wherever you go. So in that sense, check with your group insurance policy and see if you're going to be covered in the state of Florida. If you're not covered in the state of Florida and you find out when you notify them, that's a little special enrollment period that you can use outside of the 60 days. So loss of coverage, change of address, marriage, divorce, children, all those are considered special enrollment periods or life changes. And those are some of the things that, you need to call me and say, hey, I don't have insurance or my insurance is ending. What can you do for me? And I will sit there and ask you certain questions to see what you would qualify for.
This is literally the easiest person to get a hold with. Like, seriously. Well, I mean, I run into you at Publix, but,
Yeah. And other places.
Yeah, and other places. And, so
we're neighbors.
To call and ask her these kind of questions, I cannot stress to you enough how wonderful it is to be able to have that person that's going to answer your questions about that and not have to go through 50 bazillion 800 numbers. So very helpful.
So, and to that, Andrea, thank you, because I truly pride myself in you not having to call the 1-800 number. You can call my direct line, and I will go ahead and answer you within 24 to 48 hours.
Okay, why don't you go ahead and give that direct line so they can call
direct line is 352-566-1892. Again, that's 352-566-1892. That is one of the benefits of me. Again, it doesn't cost you anything. It doesn't cost you anything. You can call me 24/7. Obviously, if I'm asleep, I can't really answer.
Don't tell my husband that. He might call you at 2 a.m. I have a question about a detail on
Leave
page
me a voicemail and I'll get back to you in 24 to 48 hours.
He reads the stuff, okay?
I do check my voicemail periodically throughout the day, especially when I'm on vacation. And if it's an emergency, I will call you back. If it's urgent, I will call you back. I always leave on my voicemail an alternate number if you want somebody to talk to right now. But honestly, just call me because
it's worth it. It really is worth it. Even if,
call me.
If she's on vacation, you got to wait. Okay. I mean,
listen, I have a situation right now that I'm going to have to go back to the office and work on. Young lady just had her baby.
Oh,
she called the marketplace, healthcare.gov, to add the baby. She goes to the doctor. The baby's not on file.
Ooh. Oops.
Call me because I'm going to make sure I have a personal interest in you. I know who you are. You're just not another random number that pops up on a computer screen. No. And I am going to make sure that everything is taken care of and it's done right.
Which is why I want people to know you.
Thank you.
Because it's worth it. Okay. These are the people. These are seriously the people that I have in my life that I am like, just call her. Just like I don't have to know anything about health insurance. I have to find somebody that I know will educate me and will take care of my friends, my family, and will, do right by us and answer our questions. And you've always done that for years. She's done that. So, with absolutely getting absolutely nothing in return. So please, listen to me.
At least for you, the consumer, there is no cost.
Right.
Florida Blue does take care of us.
Yes.
They compensate us.
You don't work for free.
Right. But for the consumer, it's the benefit that they don't have to sit here and say, oh, well, how much do I owe you for today's visit? I'm not a doctor.
It's not like that.
No,
you don't have to go in there with your checkbook and go, okay, what do I owe you for today? It's not like that at all. No. So I don't know why anybody wouldn't at least talk to you about what their options are.
Thank you.
Okay, so one last thing that I want to talk about is Kidcare. I know you're probably going to go like, but in the state of Florida, child insurance is mandatory. A lot of people did not know that. They have a lot of options for even if you cannot afford health insurance for your children, they will be taken care of. The state of Florida does not believe that any child should be uninsured. So you can actually get into trouble for not having your children have health insurance. I've actually seen this happen. So So you do want to at least look into that. Is that something that you can do or that you can look into?
Unfortunately, the Kidcare part of it is a state-run program. I can give you the phone number, tell you where to go locally to go ahead and get that application, but unfortunately, that's my extent of it.
Right.
I'm not a certified or trained in Kidcare or Medicaid.
Right.
Not Medicare, Medicaid, which are two different things.
Right.
So, but yeah, no. But if, let's say, for example, you have been denied the Florida Kidcare, or you find that the Florida Kidcare is, not reasonable for your budget, call me. It doesn't hurt. It doesn't cost you anything to call me and say, hey, how much is it for my children? Mm-hmm. So that way, and then of course we'll talk about the Affordable Care Act and, anything that needs to be, added, or the health issues that they might be needing to be seen. And you and I can make a conscientious decision on what's going to be good for you.
I 100% have seen you do that even with my family over the years, and what the options are and what insurance and stuff, because there are more options for children, that just like there's more options for seniors, there's more options for children in the state of Florida than just adults like myself.
No, and can you believe that even with that fact, still there's 40% of the population that doesn't have insurance?
Please don't do that. Please don't do that. I promise you. There was, when I moved and my husband and I were getting married, there was a lapse in my health insurance for all of not even a month. Okay, there was a lapse because I was switching. It was absolute mayhem. Okay, he had 2 kids. I had a child. My sister was moving. We were moving counties. We were moving the kids with school. It was a lot. So I was like, I will take care of this. Do you know what happened during that 4-week time where my daughter had never had any issues whatsoever? She was chasing her soon-to-be stepbrother through the house, tripped over one of my soon-to-be husband's shoes, and fractured her arm. I had a lot of medical bills thanks to that. She's never had any kind of lapse injury, but I was like, what are the chances that you literally, what are the chances?
Well, here's the thing that a lot of people don't know either is that, the reason you have insurance is just like car insurance, because you don't want the liability of somebody to come after you and say, hey, you owe us this money, you owe us for this property for car insurance. And guess what? We're going to start taking some of your personal items to pay back. And it can go to that extent. So it's the same thing with health insurance. If you have a huge astronomical bill, God forbid, you had a heart attack. We know heart attacks are super expensive, especially if you need a surgery.
Yeah.
You do not need the hospital to come after your personal belongings that you've worked so hard for and add to the punch that you just had a heart attack. That's why you have the health insurance. And I will tell you that the maximum out of pocket right now legally is $9,340. That will not put anybody in bankruptcy, but you can work payments with that.
That's an overnight with a stay in the hospital. My dad has suffered from heart attacks in the past.
I'm sorry.
It's okay. At this point, he barely even calls me to let me know he's had one. He just has some health issues. So I don't know. I think we're up to the number 6. I'm not sure, but
he's had a few.
He's had a few issues. But yeah, the first time I think it was $90,000 for one overnight stay. He's up in Michigan. And it was outrageously expensive because they had to do all sorts of tests, and they had to do, they're not going to let you walk out of there without going through all the tests, because it's a heart attack. It is serious. But yeah, no, I felt my own pain with, I'm sorry, but one little emergency room visit and some x-rays. Whew, that was painful.
Listen, I had to go to the emergency room last year, May 13th to be exact. It was $17,000 just to walk in the door.
Ouch.
$17,000. That's not counting all the tests, because a lot of you may have experienced that a lot of things now get billed separately. Yeah.
Oh yeah.
So, $17,000 plus the echogram, plus the blood work, plus the IV. I think it wound up being a total of $25,000 just for that visit.
Ooh, that makes
Thank God I had the insurance.
The broken arm looked not quite as bad, but yeah.
Well, and here's another thing though. When you have the insurance, a lot of people don't know this. You're going to pay the contracted price. You're not going to pay that $17,000.
Yes.
So my actual cost out of that was like $3,000.
Wow.
$3,000 because I had insurance.
Yeah.
And that was the contracted price. So it's a huge, huge benefit to have health insurance. Even if you just get the maximum, a lot of people call it the catastrophic or hospitalization insurance, get it.
Yeah. I think normally you're already going through something traumatic. Like my little girl was hurt. They're having to do x-rays. I'm holding her hand. I'm crying. She's crying. We're both crying.
Yep.
And then to have that extra worry about, oh no, we don't have insurance right now. Just having that compounded and made everything much bigger and much worse than it even was.
Yeah.
It was a very, very minor fracture. But at the same time, I can't imagine, having to deal with a spouse or something that has a heart attack and you're now looking at tens of thousands or even hundreds of thousands of dollars coming in. And that's going to be part of your focus instead of taking care of your loved one.
Well, and here's the other thing that people also need to consider. Having the right type of insurance.
Right.
I just had a couple. He was turning Medicare age in February. He had gone for some cancer testing.
Oh, wow.
And the plan that they opted at the time to do for the rest of 2023 did not include Moffitt Cancer Center, which he needed to go to.
Ooh, no.
So it's very important that you know who your doctors and your hospitals are that plan covers. Now, I will tell you, I have been trained. Our agency trains all of our agents. That's the first thing we do. Who are your doctors? What are your medications? What are you being seen for? Right. And that's how we can make a determination and a recommendation for what plans you should be on.
That's great. Tirsa, thank you so much for coming in. I really appreciate you coming in and just discussing some of these issues that I've had asked of me. And of course, I basically don't know that much about. I know I'm covered. I know my family is covered. I know we're thrilled with our insurance, but it's not anything to do with us. We just go to Tirsa. So
Thank you.
Now you guys know her. And so when I say, just call her, you'll know what I'm talking about. So you can actually, put a name to the face and all of that. But
thank you.
Please share that phone number one more time and the actual company name that you work for.
So again, Tirsa Rodriguez, Mid-Florida Agency is Florida Blue. My phone number, my direct line is 352-566-1892. And the address here in Ocala is 628 Southeast 17th Street, Ocala, 34471.
Perfect. Thanks so much.
Thank you. Thank you for having me.
Yes.
You've been listening to What's Up, Ocala? Follow us all week on Andrea Praber's YouTube channel and TikTok. We'll see you next week at 10 a.m. on What's Up, Ocala.